I totally get you, girl. I'm partly wishing that you.
Okay, well, hello everyone. I'm Tamika. Just introducing myself. I'm a good friend of Alana here,
Yes.
and we've been friends for quite some time. We work.
And so excited for this new opportunity that you
Yeah.
found, and that you're like pursuing this, and yeah, we would like to know more about that.
Right.
What is a doula really? What's the difference between a midwife and a doula? Hello, everyone. Welcome to this segment, Mama Matters, and we're going to be talking about birth experiences. So this is something that I'm so excited about, and we're fortunate to have today an experienced doula who have assisted a lot of mothers through their transition from, motherhood.
Mm-hmm.
And we're going to talk more about what are the differences about doula. How do you become a doula? How do you become certified as a doula? So thank you so much for joining us today, Tamika. There's a lot of things that I really wanted to learn, but our time is quite limited. So we'll be focusing more about like the most important things. And it's so interesting because for me, I haven't heard about what doula is until you spoke to me like a few years ago that you're actually pursuing this.
Right.
And back where I came from, the Philippines, it's always like, families or like relatives who are supporting a mother who's expecting.
Correct.
Or it's very affordable to get a nanny. So a lot of families just hire a nanny to kind of like help out with the baby after birth and so on. So when I came here, I didn't know about doula. What is a doula really? What's the difference between a midwife and a doula? And we're going to talk about that today. First of all, what is exactly a doula, and what is the difference of a doula and a midwife? I wanted to know about that.
Okay, thank you. So I am a birth and postpartum doula, and I recently became a community lactation educator. So really and truly, in terms of what a doula is really just a birth support for parents who are expectant. A doula really comes in, not everyone doesn't have a sense of community. They don't have a village, right? Because when we look at it, a lot of our elders, past generations, they had community surrounding them, right?
True,
The birth of a child was a big deal. You know, it still is.
Yes.
But a doula really comes in and offers guidance and offers that support to families where they feel that they don't have that knowledge, lacking in that confidence. So you're really just there providing information, educating, and also advocating for the families in terms of making the best decision for themselves and their newborn along the way.
And in terms of the difference between the midwife and the doula, what is like that delineates a doula from a midwife?
Okay, so with a doula,
so they're very close in terms of like supporting someone who's giving.
You can say a doula can work independently, but they also work in collaboration with a midwife. A midwife is over a doula because they have a much lengthy training.
And you mentioned it's more clinical in terms of the care, right?
Right, because you can have a nurse midwife, someone that's already a registered nurse, and they went and continued in their midwifery practice. And you can have someone that had no background in nursing, and they can go to school and become a midwife. You know, I've known families or different people, no background in healthcare or anything, and they can go and become a midwife. And it's a lengthy training, 3+ years or longer, depending on your course load. But with the doula training, you can complete a doula training in a matter of a few days, depending on what it is,
how fast you are too, because it's like self-paced, right? Or not, it's gonna be
you could do, thanks to technology, we have virtual training as well as you can do in person.
Okay.
Or you could be a collaboration aboard. And then you have the practical part. So depending on how quick you're able to complete the birth. So if someone wants to be a labor and a birth doula, Generally, most programs require at least 3 births. So
Mm-hmm.
after you do the actual training, you have to go and support families. You do
Okay.
3 births. You have
Mm-hmm.
to do like you write reflections about the birth experience, how
Mm-hmm.
you advocated for the families
Mm-hmm.
and things in that regard. So that's the difference in terms of actual training. You don't
Mm-hmm.
do no clinical, but it's more of advocacy and providing emotional support as a doula versus a midwife.
Based on like the experiences that you have with mothers who's giving birth, what are the things that really strike you the most? Like,
Okay. Feeling overwhelmed.
mm-hmm.
Moms, it's a new experience, especially if you're first time mom. It's kind of like they're overwhelmed. They didn't realize it would be so much changes.
Mm-hmm.
Bringing a child into the world is
Yes.
definitely a blessing.
Yes.
But incorporating that child into this new life
Mm-hmm.
that you're trying to build, can be challenging. It takes a little time to do that, and sometimes people feel guilty. The biggest thing is saying and asking for help,
Mm-hmm.
because if we look, sometimes we see other people, the presentation looks like they have it all together,
Mm-hmm.
but they really don't.
That's so true. That's so true because for me personally, I felt like, I prepared myself quite enough. I wasn't. I mean, I'm a nurse and I knew all of these things by textbook. But when I was the one who's actually experiencing everything, it's a whole lot of different perspective. It's a whole lot of different experience that you're the one who's actually feeling the pain
Right.
and feeling overwhelmed instead of the other one who's like supporting you.
Right.
It's quite different, and I I wanted to know more about like how it is during a labor and delivery. What do doulas do during this phase?
Okay, so I'll start with, generally, when you're matched, say family is looking for support.
Mm-hmm.
So generally,
So that's how you are connected to this family. You're matched
yeah,
to
so we're
these
matched. So
families,
there are,
and they find you where like
you have different doula agencies based here in
agencies.
New
Yeah.
York.
Okay.
You can affiliate and collaborate with the different agencies,
But
or it
can
could be
you
word
like
of
find them
mouth.
in Indeed or like
Yes,
doulas have their own like private practices, right?
right.
So if you're doing private practices, so they can also find you in.
Yes.
Okay.
So they actually have directories,
All right.
various different
Okay.
directories, different websites if the person is on.
Okay.
Or oftentimes it could be your own circle of support, or somebody that you know, or
Or referral,
hospitals
right?
that,
Like I
yeah,
know this
and
person, and
correct.
So once you get matched, and then
Mhm.
what happens during labor and delivery?
And generally, I'll start with you before we go to labor. Usually, it depends on the type of support families want. Maybe
Oh,
somebody,
because there's different doulas, right?
right.
Birth doulas,
You have birth doula, and then you have postpartum. So
postpartum.
some families maybe just want support with the birth.
Mm-hmm.
Some want support only with postpartum. They don't need support with the
Okay.
birth, because maybe they already have their families there, but
Mm-hmm.
maybe they're limited to their stay or limited to the time that it can provide.
Mm-hmm.
So some people will just prefer, either or. We
Yes.
can be accommodating, but it generally starts with a prenatal visit. So usually we'll
Yes.
do like a consultation.
Yes.
We'll get a rundown, your expectations,
Mm-hmm.
what it is that you're looking for.
Mm-hmm.
Some people have a partner, sometimes they don't.
Yes.
And we're not there to judge. We're
Mm-hmm.
just there to support the family, listening to you in terms of your concerns, the type of care
Mm-hmm.
that you're looking for.
Mm-hmm.
If you want prenatal visits, we can go with you
Mm-hmm.
to your prenatal appointments,
Okay.
follow up.
Mm-hmm.
Maybe there's certain things that you want to ask a doctor, and some people might feel like, the doctor's kind of dismissing what they're saying and not listening to
And
them.
they're always rushing because there's like 50 more patients that they have to see during that
Right.
clinic time, and I get that.
Right.
Yeah.
So we're kind of like, we don't speak for you. You can speak for yourself, but we're helping you with self advocacy. So we just kind of echo what you're saying a little bit louder so you can be heard, right? Which is a big thing, self advocacy and body autonomy. That's very big and very important.
Yeah.
So we'll start with the prenatal visits, making sure that you're eating well when it comes to nutrition, you're taking
Yes,
care of
very
yourself.
important.
You're limiting your stress level. So all those things when it comes to the prenatal care, following up, and then you're checking in with us, because Usually you can get matched at least when someone is like in their third trimester, around 6 months. Some people before, earlier, right?
Mm-hmm.
So you really have a good stretch of time
Mm-hmm.
that the doula is building a good rapport
Mm-hmm.
and a relationship with that family. So it is a definitely intimate experience that you're having over several months, and especially if they want postpartum, it goes several weeks or a few months into postpartum.
So the services actually really do last like 9 months or more than 9 months, right?
It could be depending on what your family. Because say we match with them in the second trimester, we're still supporting them to the third trimester. Labor and delivery after the baby is born, it could be a month or 2 months in postpartum, or 3, depending on what the family needs. So you're certainly working with them for quite some time.
So you get to know these families, and they become really also close to them, or like connected
very
to
much
them.
So. And we communicate. We try to make it easily accessible, because sometimes mom is not feeling well. Maybe she don't want to talk on the phone. So we also go with text, we go with email, if that's the quickest way for them to respond. And we really, when it comes time for labor and delivery, usually around 37, 38 weeks, we're on call 24/7, because baby can come at any time.
Yes, and
hour.
And that's so true. Even if you plan your pregnancy way ahead of time, there's always going to be changes along the way, last minute or like even midweek. Some people like deliver early than expected.
And I've missed births, because sometimes in the excitement, moms have forgotten
to call
their doula, and it's like, okay, all right, they'll check in at that time. Although you missed the birth, you still go check in on them, because now you're going to go straight into postpartum care and just checking on them and making sure that they're okay. So even before the labor and the birth, we start with prenatal care and making sure that they're okay in that regard, and just holding space for their emotional well-being. Now, when we get to the actual labor and delivery, during those prenatal visits, we would have discussed your birth preferences or your birth plan, right?
Yes.
Say preferences, because it can change.
So whether you wanted epidural, you want a C-section, you wanted to have normal delivery, and so on, right? Like those things.
So it's kind of like, okay, let's start with maybe the mood of the room. The bright lights. We know that in the hospitals, there's different teams working back and forth, coming in.
Shifting.
Maybe let's limit the coming in at different times, especially if mom is trying to rest. If you're coming in the room, be mindful of the bright lights, because we want to keep a nice, calm ambience to relax mom, right? And a partner. So environment is very important. Maybe essential oils may help. They like that. We do essential oils,
music
whatever
therapy.
It is. Yes. So any of those things we discuss. In terms of food. Now, some hospitals don't like moms to eat, but who says that mom can't eat? You can eat.
You should be eating, because of all the work that you're going to be doing. You need the energy to do it.
Yeah. So we advocate that moms can have something to eat, right?
Except if they're expecting to be on a C-section. In that case, then you really have to like hold on. But since they're on IV, they probably won't feel hungry, because it's going to be like, glucose can be provided through the veins. But otherwise, you can still eat, right? It's a common misconception that, you need to stop eating when you're laboring. No, you definitely can eat if you have, the energy to eat. In my experience, I didn't, because I was so focused on like the pain and like how to breathe in and out, and just I forgot about all the rest. Like me and my breathing techniques. I was like, I need to get through this. I need to get enough air in my lungs, and so on. But,
and laboring takes a lot of energy, right?
Yeah,
so
definitely.
Having some sort of nutrition. I understand circumstances. Sometimes they just want to give you clear liquids, but mom needs a little bit more than a little broth or some juice or something. She needs, some, baby takes a lot of her energy, right? So just. It's not that they can't eat. We're monitoring what's going on. As long as everything is okay, mom should be allowed to eat more or less, right?
And food should be available in the bedside during that phase.
Correct. Also, when it comes to, we have interventions. while you may want to labor and have a natural birth, let's still discuss interventions because anything can happen, right? So we have inductions, you have C-sections, epidurals. We discuss those things. We focus on providing evidence-based information to the families. So when we're discussing C-sections and inductions, we'll share information or share different websites that the families can go and become more informed. So by the time they do get to their labor, they have a better understanding, right, of what's going on.
And education is very important in terms of like just setting your expectations. And well, there's a lot of also programs that provide that, but it's a paid one.
Correct.
One of the hospitals that I give birth to offer that service, and it's just not for the mothers but also for their partners or the people that are supporting that expecting mother.
Correct.
Which is very important because we don't have that. I mean, in the Philippines, education is very like not so important. It's like on the bottom of the the priorities of people, but when in fact it should be in the top, because knowledge is power. The more you know, the more you're able to decide wisely for yourself and make the right choices.
Correct.
And I think that having a doula by your side to give you that information is really a big advantage already for mothers. Yeah.
Correct.
Yeah.
Consent is very important.
And consent, like the consent, sometimes you just sign it. We don't even know what's in there. But
and think about it. You're overwhelmed. You're having pains. You're feeling discomfort. And someone's coming into your room asking you to sign something. In that moment, even if they're explaining it to you, you're not in the right headspace to even process what they're saying. And sometimes just to not want to be bothered, you sign, and it might not be something that you actually
really want for yourself. Yes.
That's not the place. You discuss these things prior, and even when you're going to the prenatal visit, you have these discussions with your provider. So that's why all these little things were put in the birth plan. Some moms want to keep their placenta, right? They want to take it home. They do what's called placenta encapsulation.
Yes, or sometimes they ask also permission if you want to send it into laboratories that do some what do you call that, stem cell research. Yes, they do that too.
So all of that, just giving someone the option of what they want to do versus you just taking it away and not letting them know.
Right. And some cultures also have the practice of burying it under, like I know my husband's the Hmong culture, they do that for I think because of their belief that if you separate the placenta from the baby, the spirit will be like separated too, and so on. But these are very specific traditions that healthcare workers or providers should also be aware of. And if you're a doula and and you're more familiar with the patient, you can advocate for what they really wanted and not feel so like shy about asking for the placenta after.
I agree, and thank you for mentioning culture, because that's very important. We support people from all walks of life, different backgrounds, and incorporating their cultures and tradition into the pregnancy journey and birth experience is very important. And we also have to make sure that the providers understand that and incorporate that as well. Same thing goes for oh my goodness, it's not coming to me. Help me out here. So I'm having a brain fog. When mom puts the they want delayed cord clamping. So mom will want to have the baby, on her
attached first before they actually cut the cord.
Because oftentimes they rush to do it.
So for the viewers, because most of the viewers or listeners probably haven't experienced giving birth. So what happens is when you give birth to a baby, it's going to be connected with a cord to the placenta, and when it goes out, automatically the practice is they cut it. Some of them still, the golden practice is you need to milk it towards the baby, so the remaining blood in the cord will still go to the baby. But during that time they cut it right away, so that the the heart of the baby can function by itself without depending on the mother's
Mm-hmm.
blood. So so what Tamika is saying, that some mothers would prefer to have the baby attached to
Mm-hmm.
them first
Right.
before actually cutting the
Right. And do some skin to skin,
skin
have
to
baby and
skin.
mom, and just all the nutrients
Mm-hmm.
can, most of
Still,
it
yeah, still
is
go
go
to
to
the
the
baby,
baby.
still have
Right.
time without actually pressuring it, because milking can add pressure,
Yes.
and then for babies who have like weak hearts,
Yeah.
that can also be affected, and compared to just giving it the right time
Yeah.
to like
Because they can oftentimes, soon as the baby are born, they might cut it, within the first 30
right, yeah,
seconds or
right
minute.
away, yeah.
But you can leave it for,
Yeah.
2 minutes, 2.5
Which
minutes.
not a lot of mothers know that there is an option to
Yeah.
do that. And with my experience in my second birth, because I have a special child, that I was very particular about how the process goes, because every little thing matters.
Mm-hmm.
And because she's special, we are expected to have her admitted directly to the NICU.
Mm-hmm.
And I was hoping, of course, that that doesn't happen, but at least my hope was to have a skin to skin with her, so we can be connected before we actually separated.
Mm-hmm.
And so I was alone during, I wish I have you at that
Mm-hmm.
time, but she wasn't certified yet at that
Yeah.
time.
Well,
But
and I couldn't make it,
and she
unfortunately,
couldn't
at
make
the
it
time
because
to
I gave
support you.
birth
Yeah.
ahead of time. I mean, it was I gave birth 1 week earlier than expected, and nobody was available to be there with me. And my husband luckily found an interview, and I didn't want him to miss it, so he
Mm-hmm.
wasn't with me, so I was all alone. But as a nurse, I knew that skin to skin is very important
Mm-hmm.
in the first few seconds and minutes of your birth. And I really fought for that. I was like, they wanted to take care of the baby because, of course, they wanted to make sure it's breathing properly, because she's a special child. And so I gave enough time for them to check the temperature, the vital signs, and so on. But after that, I was like really insistent, can I have the baby, please?
Yeah.
Can I have the baby, please?
Yeah.
I need to have the baby.
You want to hold her.
And
Yeah.
so I have to advocate for myself because I
Yes.
don't have someone. But for me, it was hard because you're in pain.
Mm-hmm.
You have a laceration down there, and you're like, just trying to control your emotions because you just gave birth. You're
Mm-hmm.
happy, and at the same time you're in pain. And so at that point, I was like, I wish I have someone to
Mm-hmm.
to advocate for me. And not, if that was someone who doesn't have
Yeah.
any information about
Mm-hmm.
the importance of skin to skin contact
Right.
after giving birth, then they would have missed that opportunity. That only is what comes only once.
Yeah.
When you give birth, after, when you miss that, it's done. It's already,
Yeah.
time has passed already.
Yeah.
But the impact of that simple moment of being connected, being able to latch on the baby to your
Mm-hmm.
breast, and that made a difference for my special
Right.
child too, because she was able to breastfeed at that moment,
Mm-hmm.
which they were like surprised, like, oh, she latched.
Yeah.
And those are the difficulties of a person with what my baby has.
Yeah.
My baby has a Down syndrome, trisomy 21, and one of the things that really is a challenge for them is to be able to latch on and do breastfeeding.
Mm-hmm.
Because of the way their mouth is formed. They have really big tongue compared to the proportion of the mouth. So they have small mouth but a big tongue.
Mm-hmm.
So latching is so difficult. So yeah, skin to skin is really, really important.
It's
and
essential. It makes a difference. And
it makes a difference.
just to circle back, so just that's what we put in the birth plan or birth preference. If mom, family wants delayed cord clamping, respect their rights to that. And then again, early initiation of breastfeeding. That's so essential. It's so important, as they call the golden hour. At least the first hour. Taking time. Most hospitals do have lactation educators. So even if we're there, the lactation educator can still come in, which generally we call them IBCLC, International Board certified lactation educator
Yes.
that come and support the family as well.
Which
Because when
is
we leave, they're going to be the ones there. So usually I'll often ask for the lactation educator and say, hey, even though I'm trained and I can support mom, I'll still say mom need help with breastfeeding, because when I'm not there, we want somebody else to come in and support them until they get discharged from the hospital. So those are like a few of the main things that we'll cover in terms of birth plan, birth preferences, and anything else that mom wants. Some families is like they want the baby to room in with them. They don't want the baby in the nursery, so we put that in their birth plan as well, right? You know, and because shifts often change in the hospitals, we'll bring the birth plan. If I'm there now and it's a 7 to 3 shift, also make sure the next shift gets a copy, because sometimes things get lost in communication with one person didn't endorse to someone else. But when you open the charts,
that's why
patients,
it's important. The continuity of care is very important.
Correct. So that's very important, and just anything else that the family would like, you know. But even with that, we make room for space in terms of anything can happen. So while we discuss this and you want to have a natural birth, sometimes maybe mom is tired, she's exhausted, you know, a couple hours, days has passed. Okay, maybe let's go the route of induction, especially if she's maybe only a few centimeters and she's tired and exhausted. So if, you know, we'll talk, okay, how do you feel? Do you feel that you can continue to stay like this the way you're feeling? Or do you feel like, okay, maybe you want to try the induction? We explain,
and also depends on the situation, on the status of the baby, because sometimes the baby can be sat, or you know, the oxygenation is not going well.
Correct.
And in that case, the plan is going to change.
Right.
You know,
if the baby's in distress, then we make sure mom and baby's health and well-being come first before anything else. And oftentimes that's where we'll have to go to a C-section, because we always want to make sure mom and baby is well. So we don't only just look at a safe birth. We want to make sure that when mom is laboring, she's having a pleasant experience. Because unfortunately, it's nice, mom, the baby is here, we had a safe birth, but mom has been traumatized from her labor and her birth experience. And she goes home with that. The providers are not there seeing that, but the doula is. And the doula is the one that's holding space, supporting the family and comforting them after they've experienced something that, you know,
traumatizing.
They didn't anticipate.
That's a beautiful thing, to have someone right by your side when, you know, you needed that emotional support. And even if because I want to talk about, like, you know, having a partner and not having a partner during birth, because you know, this can happen. Some people give birth all by themselves, so sometimes they have partners or families around. And doulas. So what is your role like when it comes to, like, if there's a partner during the delivery? Where do you know?
So we don't take the place of a partner. That's usually a big question. Tell people we're there just additional support. We want you to have family and friends and your partner there, because it lets us know that we're not around, you have other people that can help you and support you. So we're educating whoever's there that's going to be there with you. We're providing education and guidance to them the same way we're providing education and guidance to you. So generally, most of the time, it's usually 2 people in the hospital. So if the partner's there, the doula can be there as well. You know, those might be the 2 support people. We're trying to get hospitals to understand that doulas work in a professional capacity. Oftentimes they consider us to be a visitor. We're not a visitor, because we're working, right? I'm on the clock, and if some hospitals are pushing back and say, well, maybe the client's mom is there and her husband is there, that's the 2 people. Some hospitals might let you know, swap, because I've had that experience, but some might not. It presents a challenge, because how can the doula support and advocate for the client if they're not there with them? You know, so that's a big thing that we're just trying to work it out and see and make sure we can collaborate with the various hospitals and providers, you know, that we're working with, and understand the doula is there in a professional capacity. I'm not a visitor, you know.
Did it happen that a mother has to decide between you and the partner which one she
It's never happened to me
yet?
and I wouldn't want to put my client in that position before, if that's the case, because we also want the partner, whoever there, to be the support person, and to whoever the additional support person is, we try to make sure that we try to include them in those prenatal meetings that I talked about, so they can understand too and advocate for them as well. But if there's any pushback and we have to be outside, sometimes there's actually families that have asked where they're like, listen, our family want to experience the birth, because sometimes they feel like, okay, well, you're not family, and respectfully, I'm not. I don't take it personally.
Yes.
I get, you know, I'm only here for a short time. You guys are going to be here for the rest of your lives. So if you want me to step out, I can step out, but I'm only a phone call away. I'm still on, call me on the phone, right? Thanks to technology, or if you want to put on the video, I'm right here. Any questions, keep me updated and let me know what's going on. If there's any issues, then I'll come in. So I've stepped out the room and give them that time and have the family enjoy that birth. I'm still participating in the birth. I'm just outside the door. You understand?
Just giving them some privacy to like just be with themselves.
You have to respect what the family wants, and as long as letting them know, we'll make sure, you know, you let them know this is what you want, or we're telling the doctors or the providers or whomever, the nurses. So it's been situations like that. You know, I work for the client. So if this is
whatever their preference is, you follow that. And some husbands might not also be comfortable being there, you know, and that's an opportunity for you to be the one to be with them.
And we try to get them involved, for instance, with laboring, right? So if mom, as an emotional support person, sometimes we can, if it's just bringing them water or ice chips, putting a cool rag on their head, you know, they can be hot and cold. Hot and cold, you know. Making sure, again, the environment is pleasant for them. If dad needs to step out and get fresh air because maybe he might be overwhelmed, he knows that somebody is there that can keep him updated in real time if there's any issues or anything arises. You know, oftentimes it'll be like, go dad, go sit down in the car, or go sit down downstairs and get something to eat. We'll stay here, you know, and make sure, check in if anything happened. And that's what we're there for. We're really there to provide that additional support. We're not there to take the place of any family member. We're just add a layer. Same thing where we go home, providing guidance and education.
So, speaking of go home, because, you know, birth experience doesn't end, you know, after you give birth. It continues, you know, after you are discharged from the hospital. So I wanted to know,